My name is Vicki Monson. I'm a physiotherapist that works at Addenbrooke's Hospital, and I work within the Brainbow team, which is a team of allied health professionals on the paediatric service. I came into this role after qualifying and doing my junior rotations and then my senior rotations, where I went through the paediatrics team and service, which I really enjoyed, and I knew I wanted to specialise within that area. I got to work with the Brainbow physiotherapist through that, which introduced me to the service, and then through sort of maternity leave cover, I had the opportunity to apply for the role, which is where I am today. So Brainbow is a service of allied health professionals working together alongside a nurse lead and one of our neurosurgeons, and it's a service for all children that come in with a brain tumour diagnosis, and we work together from the point of diagnosis all the way through until they transition into adulthood, so into our adult services. And we aim to see them sort of pre-operatively, if operations is the first sort of intervention that they have, and then all the way through post-operatively until they're discharged from hospital, and then at various sort of points within their growing up, essentially. We'll see them when they transition into their next key stages at school, so into secondary school, from primary school, into their GCSEs, and then into college. And throughout those processes, we'll assess them within our different specialties, so speech and language, we have clinical psychologists, we have occupational therapists and physiotherapists. We also have an activities coordinator who works with us to help get children moving. So we'll look at their function, how they're getting around, if they need any support or sort of local service support from a physio perspective. Are they getting involved with sport? We want to help them get as involved as they can be with physical activity. But then all the other AHPs are also looking at their learning, their thinking, their speaking, their communication, their activities of daily living and how independent they can be for themselves, and just supporting them through that process in order to help them transition into adulthood with as much opportunity and independence as they can have. So within physiotherapy, we look at patients' function pre-operatively or pre-sort of management of their brain tumour, and then we'll also assess them post-operatively and support them through that rehabilitation process if there's any impairments that have incurred sort of through that process. And then we'll also sort of follow outcome measures and various sort of standardised assessments through that whole process when we're bringing them in at their various assessment points, to just make sure that we're supporting them best from a functional perspective, and that they're able to do as much as they can, whether it be that exercises that we give them, helping them go to specialist rehabilitation centres, reaching out to local services, getting in touch with schools and making sure that they're aware of what patients can do from a sort of PE or physical activity perspective. So there's lots of bits and pieces that we dip into. From a research perspective, we're working together as a group of AHPs along with our consultant to develop an outcome measure to help look at the side effects post-surgery that not everyone has, but it's just something that can be quite difficult to identify. And so this tool will help us look sort of pre-operatively, post-operatively, and then through the rest of their stay to help look at a patient's progress and whether various parts of their presentation are improving throughout their stay. So one of the things that we have been involved with and helped the organisation of has been our activities day. So we worked with the children and young adults cancer service, the ODN, to help organise an activity day which involved all sorts of things. So we had Cambridge United there, we had some Cambridge University rowers, we had the CR UK Cambridge Centre running some activities with the children, cheerleaders, musical instruments, so all sorts of activities that children can get involved with that helped sort of everyone at different levels to show that they are able to engage with these sorts of activities, and it's something that they can pursue outside of this day itself to encourage physical health, mental health, and sort of getting involved with families as well. I think it's really special that these families can all come together and have the same experiences and also get to meet each other and catch up. A lot of them know each other from various admissions that they've had, and maybe they've kept in contact or have had shared experiences, and they can all come together and enjoy the day. And it's nice for all of the kind of therapists or medical staff to come together and also meet with the families and see how everyone's doing. It's really fantastic to see everyone get involved. I think what is the most challenging is the emotional side of the role. We see patients who come in all different sort of stages of their diagnosis, whether it's a bit earlier or a bit later, and how that's impacted them from a sort of functional or independence perspective. And that also there are occasions when sadly patients aren't able to leave hospital. But then we also have the side of things where we see patients progress and improve functionally and go and have wonderful independent sort of lives. And when we see them at their various transition points where we might not have seen them for a few months or even a year or so, and they come back into clinic and we review them and see how fantastically they're doing and that they're having really, really positive journeys and brilliant sort of school experiences and doing lots out of school friendships, and yeah, it's really brilliant to see how fantastically they get on.